Hi guys, you are watching my YouTube channel, Hidden Facts. This video is part 4 of Coronavirus, a complete guide. I recommend you to watch other 3 parts of this video. Kindly like the video and subscribe the channel.
What pregnant women need to know. Early report on coronavirus, mothers and babies. In a letter published on March 26 in the Journal of the American Medical Association's JAMA's Pediatrics Journal, researchers reported on pregnancy outcomes for 33 Chinese mothers who gave birth while infected with COVID-19. Of those 33 babies, 9% tested positive for the coronavirus at birth and experienced relatively mild symptoms that included fever and pneumonia. One of the infected babies, who was born at 31 weeks, had additional challenges, but recovered. Each of the 3 tested negative for the coronavirus within a week, and, most important, all survived. Sheffield says, this report shows that it may be possible for a woman to transmit COVID-19 to her unborn baby. But because it looks at data from only a very few women and babies, we need more information before we can determine the likelihood of infection. COVID-19, what pregnant women should do now. Pregnant women can experience changes to their immune systems that can make them more vulnerable to respiratory viruses, Sheffield says. As of right now, it's too early to tell if COVID-19 in particular is associated with pregnancy loss, miscarriage or stillbirth, she says. But we do know that high fevers in pregnancy, especially in the first trimester, can raise the risk of birth defects. That is why we encourage our patients to protect themselves from any illness that causes fever, including the flu. While there's not yet a vaccine or treatment for COVID-19, expectant mothers can still be proactive. Sheffield says, if you're pregnant, you should take precautions to protect yourself from getting infected with COVID-19. Do everything you can, including social distancing, hand washing and staying in close contact with your provider. She says many practitioners are scheduling less frequent appointments to help pregnant patients limit trips to the doctor's office. Other obstetricians are ramping up telemedicine processes so that they can continue to monitor pregnant patients without an in-person visit. Should pregnant women get a coronavirus test? Sheffield says, ideally, all pregnant women should definitely get screened for COVID-19, but especially those with cough, fever or any respiratory symptoms. Hospital visitors during the coronavirus pandemic. Sheffield says that there's one more very important item for pregnant women to remember: many hospitals are changing their visitor policies to control the spread of the new coronavirus. For instance, labor and delivery at the Johns Hopkins Hospital strictly limits visitors to 1. That means a patient can designate only one person to accompany her through the birth process: a partner, a family member or a doula. The hospital's ambulatory birth center is not allowing any visitors at all while the pandemic continues to accelerate. Such policies can be hard on families, dashing plans and expectations for a joyous birth shared among loved ones. But, says Sheffield, these limits are essential to protecting patients, their babies, other patients and hospital staff. People have been gracious and understanding, she says. We appreciate everyone's cooperation in these extraordinary times. What should a woman who is breastfeeding know about coronavirus? Though breastfeeding is ultimately a personal decision, the Centers for Disease Control and Prevention (CDC), World Health Organization (WHO), and the Academy of Breastfeeding Medicine (ABM) all support giving mothers breast milk to their babies even if they are infected with COVID-19. Do studies show that the virus is detected in breast milk from mothers infected with COVID-19? At the time of this article, there are no reports of the virus causing COVID-19 being detected in breast milk. Similarly, other respiratory viruses have not been transmitted in breast milk. For example, the severe acute respiratory syndrome (SARS-CoV), a similar virus, has not been detected in breast milk. For a mother who has already been breastfeeding, should she continue to breastfeed if she starts to feel symptoms related to COVID-19? The ABM suggests if a mother who is confirmed to have COVID-19, or has symptoms and is under investigation, she should isolate from others, including from her infant, to reduce the risk for transmission. The ABM recommends a breastfeeding mother can either provide an ongoing supply of breast milk by expressing milk using a breast pump, or allow mother-baby contact for breastfeeding sessions with precautions. Should mothers who were already breastfeeding and have contracted COVID-19 be separated from their infants while infected with the virus and give their babies expressed breast milk instead of feeding the baby at the breast? Separation between a mother with COVID-19 and her infant is a decision that should be made by a health care team or specialist and is based on many factors including the mother's and baby's health. If the mother and baby are able to remain together, breastfeeding at the breast is encouraged. In this case, the CDC recommends the mother wear a mask and use good hand hygiene before and after breastfeeding. What happens if a woman with COVID-19 gives birth? Based on the CDC recommendations, if a mother with COVID-19 gives birth in the hospital, the baby may be temporarily separated from the mother to reduce risk of transmission of COVID-19 to the newborn. During this time of separation, providing the baby with expressed breast milk is recommended. Once the mother's symptoms improve and she and the baby are ready to go home, a mother would follow the same guidelines as above, either using expressed milk or allowing mother-baby contact for breastfeeding, with the mother wearing a mask and practicing hand hygiene. The medical team would help guide the mother as to the best way to continue breastfeeding in the transition home. What is the best thing for a mother to do if she has to isolate away from the baby? If the mother and baby are temporarily separated, the mother is encouraged to express her breast milk and someone else, such a nurse, will feed the child. Although the baby would not breastfeed at the breast, mothers must still wash their hands before and after pumping. The counter or tabletop surface used while pumping should be cleaned with a disinfecting products. The outside of the pump should be cleaned following manufacturer's instructions, both before and after pumping. The pump kit should be cleaned after every pumping session per manufacturer's instructions, taken apart, rinsed, cleaned with dish soap and water in a basin used only for cleaning infant feeding items, and rinsed. The pump kit may be cleaned in a dishwasher if it is dishwasher safe. Pump parts should be sanitized at least once a day following instructions using a steam bag, boiling for 5 minutes, or in a dishwasher with a sanitized setting. Pump parts should never be placed directly in the sink and should be cleaned as soon as possible after pumping. Pump parts should be placed on a clean dish towel or paper towel and allowed to air dry thoroughly before storing. Clean the wash basin and bottle brush, if used, well with soap and water after each use, or clean in a dishwasher if dishwasher safe, and air dry. Safety tips for breastfeeding with COVID-19. Mothers with COVID-19 or showing symptoms of illness are encouraged to use the following precautions when breastfeeding their infant or expressing breast milk. Avoid people who are sick. Cover your nose and mouth when you cough or sneeze. Using the crook of your elbow is a good technique, and throw away any tissue used immediately and wash hands well. Wear a mask for any contact, including breastfeeding baby at the breast. Wash hands well for at least 20 seconds or use an alcohol-based sanitizer that contains 60% to 95% alcohol before and after feedings, both feeding at the breast and expressing milk. Wash hands well when visibly soiled. Clean and disinfect countertop, outside of pump and pump kit as described above. If a mother has coughed or sneezed onto her uncovered chest or breast, cleanse the skin that may come into contact with the baby or pump. Clean and disinfect other surfaces that the child may touch.
Let's move to our topic. Thank you for watching the video. Hope you get wonderful information about prevention from coronavirus. Goodbye and take care.